Hi everyone, I'm Anglin, your Health Promotion and Development Officer at SBHI. My background is in nursing with further specializations in mental health and neuroscience, and I hold a dual master's degrees in public health and in disability. Many of you have expressed interest in learning more about menopause and its management, so I'm delighted we are finally having this session today. Before we begin, just a gentle reminder menopause is a broad topic, and today's session we will focus only on general information. But if you would like to explore it further or discuss your own experience, you are very welcome to reach out to me. You can book a one-to-one session with me or send your questions, and I will be happy to prepare a personalized information leaflet for you. I will share my contact details at the end of this session. So let's get started. Menopause describes the stage of a woman's life when her menstrual periods stop permanently and she can no longer get pregnant. This usually happens between the ages of 45 and 55. In this diagram, you can see that menopause has four stages. Estrogen and progesterone are two important hormones that play a crucial role in this transition. Estrogen is shown by the red line and progesterone by the blue line. In premenopause, both hormones rise and fall regularly and periods occur normally. During perimenopause, the red and blue lines fluctuate irregularly and periods become less consistent. At menopause, both hormone levels drop sharply, especially estrogen, and periods stop completely. Finally, in postmenopause, the red and blue lines stay low and steady with no menstrual periods. Menopause can be classified into four stages: premature menopause and early menopause, perimenopause, menopause, and postmenopause. Menopause that happens before age 40 is called premature menopause. Menopause that happens between 40 and 45 is called early menopause. About 5% of women naturally go through early menopause. Perimenopause is when you have symptoms before your periods have stopped completely. Symptoms can start 7 to 10 years before your periods stop. Menopause is a point in time when you have not had a period for 12 months. Postmenopause occurs after a year without menstruation. Menopause symptoms may subside, and remember to check with your GP if you experience vaginal bleeding. Postmenopausal bleeding is not serious but can be a sign of cancer. Now let's talk about what can influence the timing of menopause, especially when it happens earlier than expected. While every woman naturally goes through menopause, there are some factors that can cause it to happen sooner than usual. These are also known as contributing factors and they may include both natural and medical causes. Let's go through them. Change in the balance of the body's sex hormones. Ovaries produce less estrogen and no longer release an egg each month. Premature or early menopause can happen at any age and often there is no clear cause. Family history, smoking, chemotherapy, or pelvic radiation treatments for cancer, surgery to remove ovaries and uterus, and certain health conditions. This slide highlights the most common signs and symptoms of menopause. These symptoms can vary widely from person to person and they can affect both your physical and emotional well being. Menstrual cycle changes. Before periods stop completely, many women notice changes in their cycle. The frequency may change. Your cycles might become longer or shorter. The duration of each period can also shift. Flow might be lighter or heavier. Periods may become irregular with missed or unpredictable cycles. Vasomotor symptoms. These are the classic symptoms most people associate with menopause: hot flushes, night sweats, heart palpitations. Psychological and cognitive issues. Hormonal changes can affect your mental health and brain function. Feelings of low mood or anxiety, difficulty concentrating or remembering things, headaches, fatigue, and sleep difficulties, and overall lack of energy. Genitourinary symptoms such as vaginal dryness, itching or discomfort, pain or discomfort during sex, lower libido, recurring urinary tract infections, musculoskeletal symptoms like joint aches, pains, and even loss of muscles. Kindly remember, these symptoms don't necessarily happen all at once, and not everyone will experience all of them. But understanding them help us recognize what is going on and seek support when needed. One of the best ways to manage menopause is to keep track of what is changing in your body so you can act early if needed. For the uterus, endometrium, and breast, be aware of cancer risks and keep up with recommended screenings. In the vagina, vulva, and bladder, lower estrogen can cause dryness, narrowing, or UTI, so don't ignore discomfort. Bones can become weaker, increasing the risk of osteoporosis and fractures. And for your heart and blood vessels, menopause can raise the risk of heart disease, stroke, and changes in cholesterol. The more you know what is happening, the better you can protect your health. Talk to your GP or nurse so they can check your overall health, assess risk, and suggest the right screenings. From there, choose a right treatment that works for you. This might be a hormone replacement therapy, antidepressants, CBT, or testosterone supplements. And remember, follow up with your GP after 3 months and then once a year to make sure everything is still right for you. Regular checkups are key during menopause. This means getting a full health assessment, keeping an eye out for any unusual bleeding, and doing recommended screenings like DEXA scan for bone health, mammograms for breast health, and blood tests to check overall well being. Hot flushes and sweating can be frustrating, but there are simple ways to manage them. Try avoiding triggers like caffeine, alcohol, smoking, or spicy foods. Keep your space cool. Use a fan, sip cold drinks, or spray your face with cool water. Wear loose, light layers so you can adjust easily if you get too warm. Opt for lukewarm showers instead of hot ones. And at night, use light bedding in layers so you can remove them if you get too hot. Vaginal dryness is also common during menopause, but there are safe ways to manage it. You can use vaginal moisturizers to keep the tissues moist and water based lubricants during intimacy. Avoid perfumed soaps, washes, and douches in and around vagina, they can cause irritation. Also, don't use creams or lotions like petroleum jelly inside the vagina as they can lead to infection. And finally, make sure any moisturizer you use is specifically made for vaginal use. Sleep can be harder during menopause, but there are simple things that help. Try going to bed and waking up at the same time every day, even on weekends. Get daylight during the day and aim for 7 to 9 hours of sleep at night. Avoid caffeine, alcohol, smoking, and heavy meals before bed. Skip daytime naps if they make it harder to sleep at night. Create a calming bedtime routine, lavender oil on your pillow, a warm milk or herbal tea, relaxing sounds, and less screen time before bed can all make a difference. What we eat during menopause can make a big difference to how we feel and how healthy our body stays. First, stay hydrated. Aim for 6 to 8 glasses of water every day. Then focus on a balanced Mediterranean style diet. That means filling your plate with plenty of vegetables, fruits, whole grains, seafood, nuts, seeds, and pulses. Have dairy in moderation and use healthy fats like olive oil instead of butter or processed spreads. Try to cut back on processed meats, refined grains, sugary foods and drinks, and keep salt and saturated fat on the lower side. Eating this way helps protect your bones, your heart, and even your mood and brain health during and after menopause. Alongside eating a balanced diet, there are certain key nutrients that really help maintain your bone strength, heart health, and overall well being during your menopause. Specific nutrients like calcium, vitamin D, magnesium, zinc, vitamin B, B5, and B6 are crucial to maintain quality of life. Kindly note, it is always better to talk with your GP about a referral to a dietitian and make a diet plan. Make sure that you are taking supplements if you have any deficiencies. It is always better to do a blood test before taking supplements so that GP can prescribe the right dosage. Keep your body active in your own way. Little and often exercise helps to maintain your joint range and muscle strength. Too much exercise can lead to increased pain or injury. Speak with your physiotherapist regarding an appropriate exercise plan for you. Exercises are important for strengthening the muscles. Based on your ability and limitations, do simple muscle strengthening exercises. Your physiotherapist can help you with this by assessing you, and you can also give your suggestions to make your job easier. Here, what matters is your comfort and convenience, so work with your physio team. Menopause can bring emotional changes like stress, anxiety, low mood, and sometimes frustration or anger. One of the best ways to protect your mental health is to make time for activities that calm and relax you. This will look different for everyone, so choose what works for you. It could be breathing exercise, meditation, or yoga. It might be reading a book, listening to a podcast, or doing something creative like art. Pet therapy and aromatherapy can also be surprisingly effective. The main thing is to find something that helps you slow down, breathe, and feel centered, and then make it a regular part of your routine. It is very common for women to notice a drop in sexual desire around menopause, and that is nothing to be ashamed of. It's a normal part of the hormonal changes happening in your body. The important thing is to talk openly with your partner about how you are feeling and also speak with your GP. Sometimes hormone replacement therapy can help improve sexual interest and comfort. If estrogen and progesterone HRT are not effective, your doctor may consider a testosterone supplement. The goal is to help you feel comfortable, confident, and connected in your intimacy. Thank you.